Hi, I'm Stu Harrison, and welcome to the Think Tank. My guest today is Keith Beecroft. He's with Peterborough Public Health, and we're going to talk about recovery. Keith, welcome.
Thank you for having us. This is great to be here, Stu.
Not at all. Recovery has suddenly become the hot topic over the last couple of weeks. I think it's happened because there's been a couple of provinces who decided to loosen some of the restrictions. Everyone from the Prime Minister to the Premier on down is talking about recovery and what that timing is going to look like. I really liked the Premier's comments the other day that it's not a calendar, it's a process. And I think that that's what we want to cover today is just to talk about from a public health perspective, what businesses should be looking for, some basic fundamentals. But before we get to that, I'm just kind of interested in your own personal observations about the role of public health. I mean, wow, what a couple of months for the public health system. And so I'm just kind of looking for some reflections from you on what that's been like for you and your team.
Yeah, it's if you'd told me 49 days ago that you and I would be sitting here at our respective houses having this conversation, I probably would have told you were crazy, but alas, here we are. And I remember when this first started coming down the pipes, we were wrapping up a program at a grade 8 class in Peterborough the Thursday before the March break, and there was some buzz in the air, but nobody really quite knew what it was. Then the Premier made his announcement on March 17th, and here we are 49 days later. And whether it's the world's longest spring break or the world's earliest summer break, I'm not sure which way we're going to frame it, but being involved with public health has certainly been kind of a bird's eye perspective to how this has all gone down. The team that I'm part of at the health unit is what we're calling the liaison team. So there's 7 or 8 of us that are specifically assigned to a variety of workplaces and agencies and long-term care settings and different things like that. So we kind of have that coordinating overview of that piece. We have a team of public health inspectors, obviously, that are working on infection prevention and control in a variety of settings to make sure that everybody's being as clean and healthy and safe as they can. And then obviously our public health nurses that are kind of in the thick of it all, doing the case management and contact tracing and all of those pieces. Never mind a whole slew of other staff that are behind at public health right now answering phone calls and have been redeployed to a variety of teams still on the front lines and being able to assist the community with a lot of questions and directions that they might have. So to say that we have a bird's eye view and kind of that air traffic controller approach is kind of where I see public health's role right now. It's been pretty neat, not neat in a neat way, but neat in a, wow, look at this community kind of way.
Yeah, and I appreciate the enthusiasm because it really is quite remarkable when you think about it. And everyone from the Prime Minister on down is depending on the opinion of public health officials, whether it's at the national level, the provincial level, or the local level. I mean, your boss, Rosanna, has been doing daily media updates, and people are depending on that information. So I think it's a great illustration of the importance of public health, similar to, I think this pandemic has also illustrated the importance of a job. I've said to a lot of people, there's not really or hasn't been a full understanding of what it takes to run a business, employ people, meet payroll. But I think there's a new appreciation for that in the last several weeks. So let's get to it. When we're talking about business and recovery, everyone is wondering how it's going to look and what are they going to need to know. And I think it will be different for every sector. If you're a retail store, recovery is going to look different than if you're a manufacturer.
Yeah.
If you're a concert hall, it's going to look different than if you're a retail store. I think there's going to be phase-in periods for on a lot of different levels and on many different time frames.
Yeah.
But when it comes to the fundamentals of public health, what is it that people should really be thinking about when it comes to their own business, whether it's an office setting, a retail setting, a manufacturing setting, and under the umbrella of safety first, what should people be thinking about?
Yeah, absolutely. And I think you hit the nail on the head that it's going to be exactly the same except different for whichever sector or workplace that it is. On Friday, when the ministry and the premier announced that there was going to be a handful of new businesses that were allowed to be open, what they did is they released at that time guidelines for how those businesses can open in a safe place. But I just want to stress that those are guidelines. They recognize that the business owner is likely the best person to make those decisions with the support of public health and people such as the chamber to figure out how best to get people back into the stores and do so safely. A shop that your chamber might represent is going to be a lot different than a big box store in terms of the square footage. So it would be an infinite list of possibilities, which is why we really, really rely on the guidelines that the ministry is providing with us. To date, I believe there's 61 of them that are available on ministry website. So that liaison team that I was telling you about at the very beginning of the chat, we're ready to help workplaces kind of sift through and figure out which parts of those guidelines make the most sense to a specific setting. So I'm hesitant to answer your question very specifically because we really fall back on that ministry direction and that public health advice that you talked about in terms of what does the science say, what do the guidelines say, and how can we best go about doing it. Some of the really basic ones, the messages haven't changed over the last 49 days. And just to be really clear that physical distancing piece is probably first and foremost the biggest thing that we can do right now. I stress that it's physical distancing, not social distancing, because throughout this time, our mental health and our connection to others is so important. So whatever ways that we can safely reach out to neighbors and loved ones, we want to still be able to do, but we want to be able to do it physically separate. And those guidelines will be the same in stores. So that 2 meter rule for sure. In some cases where a plexiglass barrier between a shopkeeper and the customer, that might be suitable. But again, we've got the guidelines for specific sectors and specific agencies that we can walk through with those business owners to make sure that they're doing everything as safely and as appropriately as they can. Hand washing, again, super important. You don't realize how many times in a day you touch your face, and I don't know if people that are watching this right now recognize my COVID beard. Right now I would be cheering on the Edmonton Oilers during the playoffs, so this would be a playoff beard, but I haven't shaved in 49 days, and all of a sudden I just want to do this all day every day. So just being aware of that hand hygiene and how frequently you're washing your hands or using hand sanitizer, making sure you're washing your hands for 20 minutes. We've heard from some shopkeepers that have started to put in hand sanitizing dispensers and thinking about the plumbing in their stores, such that people would be able to, wash their hands more frequently and those types of things. So that's the second one. The third one, again, comes down to that respiratory etiquette. So in addition to the physical distancing, if you're going to sneeze or cough, to make sure you're kind of doing the chicken wing or the cough into your elbow, absolutely important. And then the new one that we're starting to add a little bit, and this has been our message pretty much all along, but ever so more important now, is that stay home if you're sick. The ministry has waived the requirement for employers to require a sick note from their employees if they're coming in sick. So if you're sick, stay home. So really it's taking those 4 key principles, those 4 key messages of physical distancing, hand hygiene, respiratory etiquette, and staying home if you're sick. And then working through those guidelines with public health support to make sure that those infection prevention and control measures are in place with whatever that setting might be.
Perfect. And the fact that there are 61 individual recommendations means we will definitely have the link to that information connected to this segment, as always on our website, and I'm sure on yours as well. I think people can also look to the experience that they've had over the last 6 weeks, and actually you could see that evolve, the different practices from the grocery stores and the hardware store and the liquor store, and whether it's curbside pickup or distancing or limiting the number of people into your facility. I mean, those are all really good examples of what you're going to need to think about in your own business. So between your tips and tricks and just the fact that people have lived experience, I think it's important for people to plan now so that you don't get caught with the premier saying, for example, on Friday, as of Monday, all of these businesses are going to be open. And I actually heard an interview this morning. It was really quite disturbing with a garden center. And on Friday, it was announced that garden centers would be able to open under certain restrictions, limited, et cetera, et cetera. So the messaging was there. On Saturday, this garden center owner had 400 vehicles in his driveway from people who were picking up orders that they had ordered and were coming in. They were coming in and picking them up, curbside pickup, everything controlled. There was a total of 800 cars in his driveway on Saturday. The other 400 thought that they were open.
Wow.
So I think there's going to be a critical component when it comes to public education and
Yeah,
getting the message out about when something loosens up, these are still the rules. And I think that's going to be a critical thing for
yes,
agencies like yours and ours to get right, so that people understand that, yes, it's open, but kind of, sort of.
that's right.
So I think that's going to be a big part. Can you just touch on whether or not you see much of a difference between a business protecting their staff and protecting their customers?
I think at the end of the day, and this is one of the things that we heard Dave Smith say on one of his MPP town halls a couple of weeks ago, the province really, really wants to get this right. We have one chance to get it right. And I think overall, whether you're an employee or an employer, a client, a customer, whatever the person is, we're all people at the end of the day, and human health is the number one denominator with all of this. So there are certainly things that employers can do to protect their staff. And there's lots of things that customers can do to protect themselves as well. But when we're talking about what this recovery might look like, we're looking at it from the population health lens and looking at people that just need to stay home, to wash their hands, to be good to each other. So there isn't any differentiation between how that health would be viewed. Certainly there's different roles that each side of the fence could take in terms of what the person is doing to open that store, and in terms of how that person is shopping at that store. And a lot of that, again, is going to be spelled out in those guidelines that the ministry comes up with. So there's not going to be very much left to question or interpretation, so that if you're shopping at a place in North Bay, it's going to be the same experience largely as if you were in Peterborough as well. So by and large, it's really just protecting that public health as a whole, and making sure that the guidelines in place protect both sides of the coin.
Well, thank you, Keith. You've been a tremendous help. I really appreciate you taking the time. I'd have never known that you were an Oilers fan. I have to, to say that. It's all about the background on these Zoom calls, isn't it?
It was trying to decide if I go to the kitchen or where we need a new paint job, or if I go to the living room where my son's playing Fortnite after he's finished his homework, or the backyard where it's a bit windy. But I figure a little Canadian content probably never hurt anybody.
Well, it's brilliant. I call mine the spare bedroom studios.
Yeah, I love it.
All right. So we've talked about a lot today and mentioned a lot of links. You'll find them as part of this post. And if you're ever in doubt, certainly go to peterboroughchamber.ca. The COVID-19 page is there right on the homepage. It's a dedicated page with everything you could ask for from government programs and increasingly about recovery. So Keith, thanks again for being with us today.
And to you and your team, you guys are on the front lines, and we appreciate everything that we're doing together and you're doing for us.
It is a team PTBO, that's for sure. And that is the Think Tank.